More than ever, we're hearing that people with long-term conditions want greater understanding and involvement in decisions about their care. So what does this mean for the NHS and for patients? My name is Dr. Stu Farrimond. I studied medicine and enrolled on the GP training scheme. But a few years ago, I was diagnosed with a long-term condition, brain tumour and epilepsy. So overnight, I went from doctor to patient. I'm here to find out about personalisation and empowerment and what it means for us patients.
Personalisation is a way of talking to patients so that it improves their confidence and so they feel better able to manage the condition themselves.
Personalisation is really looking at that one patient to see what makes them tick, to see what they do from day to day, how they would like to live, what they would like to achieve.
Personalisation frees the human spirit, and that's what I see personalisation as. We look at outcomes, we look at how to get to those outcomes, and it's a two-way conversation. Doctors can tell me the best about the medical side of things. For me, I can tell them what makes me happy. And so they've put two together, and that then makes my life brilliant.
With complex conditions, are you going to know enough to make important choices about your care?
We're not asking patients to make medical decisions. It's not the patient or the health professional, it's the patient and the health professional. With some patients who are very, very ill, we have to make a diagnosis to make sure that they're safe, and that's really, really important. But with other patients who have a long-term condition and are responsible for looking after their own health, we need to help them feel more confident in what they do at home before they come to us.
You make choices about what you have for dinner. You make choices where you're going to go on holiday, about what you're going to wear. It's the same thing, it's all part of your life, isn't it? And it's the most important part of your life, so why wouldn't you make a choice?
Where would you go to find information about your health? There's plenty of online resources. There's NHS Direct, and there are charities like Diabetes UK, Arthritis Care and Alzheimer's Society. But how would you know which was right for you?
When I first was diagnosed with MS, it was such a vast thing to learn about and to think about, and it was such a scary thing to think about. Although I gathered a lot of information in the beginning, I had to filter it to find out what was good for me. So it took a fair while. I looked on the web, which is the thing to do, which scared me to death. Going to things like the MS Society, learned a great deal from them. And other people who have it, peer support is a great, great comfort.
The MS Society is here to support people with MS. We're an accredited information provider, and people know that they can rely on that information to be evidence-based. People may go to the website, or they may contact somebody locally to find out, or they may contact the helpline. Thousands of people access our chat rooms and talk to each other, so they get that peer support. What did you do about this? How have you done that? And there's a lot of those conversations going on between people with MS, which is really important.
It's excellent if people want to go out and find out about their condition and come in with printouts from the internet. And then we can have a discussion about what they've learned and what they want that is open and informed. We want to increase their responsibility by giving them advice when it's appropriate, rather than just flooding the patient with advice and they go away feeling that they're not really sure what to do.
Will this approach change the care that you get from your GP or other staff?
Personal health planning is an ongoing relationship, and it's an ongoing way for a patient to have more voice.
The personal health plans really do empower patients, and that document can be shared with whoever comes into their life. So it could be a pharmacist, it could be a GP, it could be a district nurse, it could be a social worker, but that's actually their story in their life and their personal health plan.
They've got the ideas about what they would like to do. We're just facilitating really, but it doesn't mean to say that the patient isn't welcome to come back in. If they then get a hiccup and they're not sure about something, they can still come in.
I've had this health plan for just about a year now, and looking back, I do see my GP less. It's made me think. I think I've got a headache, or I've got a tummy upset, or my leg don't work, and I think, shall I go and see my GP? Actually, can I do something else to make that better? Lets me think about what I'm doing, rather than just depending on going to see my GP.
So what are the real benefits of a more personal approach to our care for us patients and our families and our carers?
It's relieved me of some of the pressure of having to care for her. I still have to care for her, but I don't have to worry about her quite so much. She is in control. She tells me where she wants to go. We talk about it, we discuss it, but she takes the lead now. She decides what's happening.
It's just fantastic. It makes so much difference to patients. It gives them a new lease of life. They're just new people, and their aspirations could be anywhere.
We want people to keep their lives as open and as exciting and as full as possible for as long as possible. That's really, really important.
We've seen that through the NHS, giving you the support and confidence to make decisions, you can make choices that really do improve your quality of life.
A few years ago, when I was first diagnosed, it was like I was a different person, and I was sitting in a wheelchair with a blanket over my legs. I was told not to do too much, to pace myself, and I just looked forward to actually nothing. Now, I'm not just somebody that sits in a wheelchair anymore. I'm not being pushed about. I'll go where I want, I do what I want. I think the good thing about what's happened, about the personalisation side of things, about me taking responsibility, I'm not depressed anymore. Small things make me happy. Going for a mucker with my Alf and having lunch makes me happy. He doesn't have to worry about how I'm going to wake up in the morning. I might not feel brilliant, but I'm not going to be depressed.
The personalisation has given me my wife back. It's made her not a different person, but her attitude to life is different. She's still the same old Sandy. She's more bolshy. I think now she's a far better person in her own way. She's more in control, she feels in control, and she likes her life.